bundle. We used to call it the bundle of his. Coming out of the AV bundle, I have the right bundle branch, that thick white line, and the left bundle branch, this thick white line. And it ends up in those little bitty lines that are called the Purkinje fibers. When the signal gets there, it tells the ventricle to contract. Now, we can't see it in the model, but if you look in the lab notes, it talks about a moderator band. Moderator band is found only in the right ventricle. And when the signal's coming down the right bundle branch, it shoots across the moderator band and goes straight to the anterior papillary muscle, saying, hold on, we're going to contract. And it tells all the other papillary muscles, hold on, because the valves have already closed. It's just holding them so that when the ventricles squeeze, they don't turn inside out. Okay? Now we're at the hard part. All that blood that went through the heart went through the right atrium, the right ventricle, to the lungs and back to the left atrium and the left ventricle and out to the body. Heart didn't get any of it. Heart's a muscle. It needs oxygen just like any other muscle. So the first two blood vessels that come off of the ascending aorta are the right coronary artery and the left coronary artery. Arteries are coronary. Veins are cardiac. Okay? If she takes her finger and covers that little piece right there, she's covering all I can see of the left coronary artery because the rest of it's behind the pulmonary trunk. Okay? So we come out of the right coronary and we go down the right coronary. And I come down here to the margin of the heart. 63. Come to the margin of the heart. This is the marginal artery. Some people will call it the marginal coronary artery. Come back to the right coronary and I come all the way around to the back of the heart. This artery is laying on the back of that interventricular septum. This is the posterior interventricular artery. Then I come to the left coronary artery. And this red one going down the front of the heart is the anterior interventricular artery. And this one going around the circumference of the heart is the circumflex artery. Real quick, right coronary artery down to the marginal artery, goes across the margin of the heart. Go all the way to the back. This is the posterior interventricular artery. Come around to the front. Here's the left coronary. Go straight down to the anterior interventricular artery. And there's the circumflex artery. Now we need to name the veins. We come down and use the right coronary still because it's easy to see. It's sitting in the sulcus. Real easy to see. I come down the right coronary. It shows one blue one going across the front. It's really several of them. And these are the anterior cardiac veins. They're going across the front, the anterior of the heart. See this small one underneath the marginal artery? That's a small cardiac vein. Then I go back and I come all the way back. See the blue one right next to the posterior interventricular? See that blue one going down?